Today, we are going to talk about the convergence of the modern medicine and ancient medicine, and how yoga, Ayurveda, and the basic principles of these with modern medicine can work together with an analysis of the pathophysiologic and biochemical principle for the treatment and a scientific fundamental pathophysiological and biochemical analysis. Modern medicine largely focuses on diagnosing disease through the biochemical markers, imaging, and other technological modalities. In contrast, the ancient medical system like Ayurveda and practice of yoga traditionally emphasize balance and holistic well-being, yet many of the core principles are finding validation through contemporary scientific research. Both paradigms, although emerging from different epistemological backgrounds, share an interest in restoring homeostasis and reducing systemic stress, which is a factor increasingly recognized as central to chronic disease and the pathophysiology of chronic diseases. Let's talk of that homeostasis and the balance. Modern medicine considers disease as breakdown in the body's ability to maintain the homeostasis. Similarly, Ayurveda's concept of dosha's imbalance mirror the modern understanding of the disrupted metabolic or neuroendocrine balance. Yoga, through its practices of breath regulation and mindfulness, is now shown to reduce the stress and modulate the hypothalamo-pituitary axis, thus helping the body in re-establishing the equilibrium. Next, we talk about inflammation and oxidative stress. One key area of convergence is the role of chronic inflammation and oxidative stress in the disease. Modern research has linked these processes to a host of conditions, including cardiovascular disease and diabetes. Yoga and Ayurvedic dietary regimes, which emphasize natural antioxidants and anti-inflammatory herbs, align with the understanding by actively working to modulate inflammatory pathways and improve the antioxidant status. Let's then talk about the pathophysiological principles, and first, the neuroendocrine regulation. Contemporary research in psychoneuroimmunology demonstrates that stress affects neuroendocrine function and can precipitate the metabolic syndrome. Yoga practices, including meditation and controlled breathing, have been shown to lower the cortisol level and enhance the parasympathetic tone, thereby mitigating the effects of chronic stress on the body. And this biochemical modulation reflects a convergence with modern strategies aimed at reducing neuroendocrine dysregulation. Coming to the gut-brain axis and metabolic control, both Ayurveda and modern medicine recognize the significance of gut in overall health. Ayurveda's emphasis on proper digestion and metabolic Agni or digestive fire corresponds with current insights into the gut-brain axis and its influence on metabolic and immune functions. The use of dietary herbs and specific lifestyle recommendations in Ayurveda has been correlated with improvements in the gut microbiota, the composition of microbiota, and inflammatory profiles, thus paralleling the modern nutritional therapies. When we talk of the biochemical mechanisms of treatment, particularly the antioxidant effect, Ayurvedic herbs such as turmeric or curcumin and ashwagandha have been studied for their antioxidant properties, which help mitigate free radical damage. These effects are now understood as molecular level, involving the modulation of transcription factors such as NF-kappa beta or nuclear factor kappa beta, a key regulator of inflammation and cellular stress response. Such mechanisms undergo the biochemical rationale behind the ancient remedies and support their use alongside the modern treatment. When we talk of the neuroplasticity and stress response, yoga and meditation have been linked to increased neuroplasticity and improvement in brain function. Biochemical analysis have demonstrated that these practices can increase levels of brain-derived neurotrophic factor or BDNF, thereby promoting neuronal health and resilience. These findings are consonant with modern neuromedical or neurobiological approaches to treating conditions like depression and anxiety, illustrating a common biochemical basis for treatment strategies across the paradigms. When we think of integration of the alternative and complementary medicine, particularly yoga and Ayurveda, into modern therapeutics, the recent integrative medicine approaches are actually now capitalizing on this convergence by combining the conventional pharmacotherapy with complementary practices such as yoga and Ayurveda dietary modifications like the Ayurveda diet, which is the plant-derived diet, and intermittent fasting. And this integration is not only based on the clinical outcomes, but also on the shared understanding of underlying biochemical pathways. By aligning the treatment of chronic inflammation, stress, and metabolic dysfunction, integrative strategies offer a more holistic approach to the patient care. The modern medicine thus has its own benefits, and the ancient medical traditions like yoga and Ayurveda have their own benefits. However, these are converging on several core principles. Both systems recognize the centrality of the homeostasis, the impact of stress on neuroendocrine and inflammatory pathways, and the importance of diet and natural compounds in modulating the biochemical processes. This convergence is fostering new integrative treatment modalities that draw on the strengths of both paradigms or both systems, ultimately enhancing and improving the therapeutic outcomes of the chronic diseases.